and I feel we'll cover the diabetes كويس what types of insulin وكده and then we'll send you a paper عشان لو عندكم أسئلة عنه كويس you ask me كويس in the next session ونواصل مرة جاية في الثايرويد والother topics دي حتى لو covered by anyone else person ما بكون عندكم مشكلة يعني هي common topics حتى الدايابيتس common لكن في أشياء معينة في الدايابيتس needs to be stressed بس وهي common areas of questions I think استجابة لاقتراحكم الأول ورأي دكتور محمد نديكم على الدايابيتس شوية طيب right okay طب قديم ذاته كنت I was assistant at that time نشيل ده برا
You can make a screen full screen يا دكتور.
sure معلش طيب that's it okay clear كده
Yes we can see it.
ممتاز طيب خلينا أشيل دي برضو تحت كده طيب okay if we talk about type 1 diabetes طبعا this talk is mainly about the management كويس about the treatment هيكون diabetes طبعا is one of the metabolic disorders has multiple etiologies and characterized by chronic hyperglycemia, disturbance of metabolism of carbohydrates, fats, and protein. Well, it is due to problem with the insulin secretion or action or both. Yes, insulin secretion or action or both. It's a biochemical diagnosis beside clinical. So there are criteria to diagnose it. Either you diagnose it by the fasting glucose or using the 2-hour postprandial or the A1C. طيب. وعندنا pre-diabetic states. The pre-diabetic states are impaired fasting glycemia and impaired glucose tolerance before you have frank diabetes. You need to be familiar with the millimole versus milligram per deciliter. كم بيساوي كم؟ 1 millimole بيساوي كم مليجرام per deciliter؟ اكتبوا في الشات 18 that's right. Okay, so when we say good, yeah, good. So when we say 11.1 millimole, that means 200. Yes, for the patient who have diabetes will have blood glucose above 200 milligram per deciliter, 11.1, and the fasting glucose above 7, which is 126 milligram per deciliter. But this is a common question you are asked about من الببليكس يسألوكم متى أقول إنه ده diabetes. There is a kind of random above 200 milligram per deciliter or 11.1 millimole, or the fasting is above or equal 7 millimole per liter or 126 milligram per deciliter. طيب النورمال إنه يكون الراندوم less than 7.8 معناها النون diabetic ممكن بعد heavy meal مثلا sugary meal can go up to 140 milligram per deciliter. طيب إذا كان upper limit في 2-hour postprandial is the patient is at this level fasting glucose المفروض يكون less than 110 في non diabetic. إذا patient في patient between 110 and 126, that means this is a patient in an impaired fasting glucose status. وإذا blood sugar after meal goes above 140 up to 200, this is a pre-diabetic having impaired glucose tolerance. That means he cannot tolerate a heavy meal with glucose. Yes? فإذا الأرقام دي تكون واضحة عندكم. Less than 110, yes, this is usually normal in fasting state. Between 110 to 126, this is impaired fasting glycemia. Above 126 as fasting, this is diabetes. Above 140 to 200, this is impaired glucose tolerance. 126 to 140, this is normal postprandial. Above 140 up to 200, this is impaired glucose tolerance. Above 200, this is diabetes. واضح كده؟ البلود هيموجلوبين A1C طبعا دي ارقام مكتوبه from different references لكن now we use 5.8 above 5.8 يعني 5.8 or 5. من 5.8 and above لحد 6.5 this is pre-diabetes. Less than 6 less than 5.8 this is non-diabetic. هي حاجه less than 5.8 في ال A1C non-diabetic 5.8 to 6.5 less than 6.5 6.4 يعني this is impaired أو pre-diabetic state سواء كانت impaired fasting glycemia أو impaired glucose tolerance. Above 6.5% this is diabetes. هو ده هنا. طبعا you cannot use hemoglobin if there is hemoglobinopathy. So if the patient has got hemoglobinopathy you use what؟ واحد يقول لنا ايش you can use؟ Excellent, Aisha. Fructosamine. Fructosamine is another type. But fructosamine, how you use it is more difficult question. You use it every 2 to 3 weeks, not every 3 months. Okay? So in short duration, بتغير. الحاجة الثانية طبعا this is depending on what is attached to the hemoglobin. يعني حتى ال A1C انت بتستخدمه كيف؟ what is attached to the glucose I mean sorry. Fructosamine get attached to the glucose ده الهاف لايف بتاعته. فلأنه الهاف لايف بتاعت الهيموجلوبين 120 days after it come out of ruptured RBCs عشان كده انت بتستخدمه في 120 days. فلو كان عندك هيموجلوبينوباثي use fructosamine في tables بتوريك this level of fructosamine is equivalent to which percentage of A1C. هسه ال A1C نفسه الآن بيستخدموه بالبرسنتج أو مليمول تو مليمول. كويس؟ مليمول تو مليمول as a reference النورمال 57 or 56 point something. المستخدم في يوروب in order to benchmark your findings with other centers. لكن الكومن use percentage. طيب الآن نشيل كده aside. طيب symptoms of hyperglycemia and findings of this based of any of the things in the bottom here will diagnose diabetes. So it's a biochemical diagnosis. Well, usually you need consecutive readings, so 2 of the fasting readings instead of 1 to make the diagnosis. Like if you have the symptoms and you have 1 of these readings, this is diagnostic of diabetes. However, if a patient receives corticosteroids or any other hyperglycemic treatment, this can result in what we call incidental hyperglycemia. Incidental hyperglycemia. طيب واحد كده يجاوب السؤال ده شوف انه فهمكم في الديابيتس كيف يعني. هل الأقرب لأنه to develop frank diabetes impaired glucose tolerance ولا impaired fasting glycemia؟ fasting. واحد قال impaired tolerance. GTT يعني impaired tolerance قصده. GTT fasting. مين اللي بيقول fasting؟ كويس. أول واحد قال fasting. خلينا نشوف. أول واحد قال fasting. أول ما اختار fasting صفاء موسى تبين. طيب أدي صفاء فرصة يا محمد تورينا ليش fasting أو إناث للثانية أو تنزيل. مين عاوز يشرح لنا ليش الفاستنج هو أقرب؟ ما في حد. يمكن بعيدين. anyway طيب الفاستنج هو الأقرب صح الرايت. وذلك لأنه يعني if you are not able to keep the blood sugar during fasting state optimum, that means your insulin secreting capacity is getting very limited. But if you have failure to do this with a glucose challenge, that is a lesser stage or milder stage of risk of diabetes compared to fasting. level. فimpaired fasting glycemia is more near to develop frank diabetes than impaired glucose tolerance. الimpaired glucose tolerance هو اللي بيحصل مع OGTT. Good. طيب type 1 diabetes, type 2 diabetes, gestation and other types of diabetes. طبعا الأسماء القديمة insulin dependent diabetes mellitus, juvenile, it's autoimmune, idiopathic. This is defining it by the cause or the etiology. لكن the popular and the correct and the most recent one is type 1 diabetes اللي هو ده أكثر حدوثا في children, juvenile, وهو insulin dependent. Yes, it's true. لكن we have type 2 diabetes when in the last resort become insulin dependent as well, when they have their pancreas is not functioning completely. So it's not true to call it non-insulin dependent. لكن هو أكثر في adults. And also we have MODY, which is a maturity onset of diabetes in young. So that's why the adult and juvenile is not a popular or good classification or fair one. Insulin, non-insulin dependent is not a fair one as well. So the triad of type 2 diabetes is to have this triad of family history, obesity, especially abdominal obesity, and acanthosis nigricans. But you can have it also in lean body mass patients. Gestational diabetes that occurs in pregnancy. And then the MODY or the monogenic diabetes, congenital neonatal one, is part of it. And then we have secondary diabetes that occurs because of excess of counteracting hormones to insulin, such as cortisol in Cushing syndrome, thyroid hyperthyroidism, or any other source of counteracting hormones. So the basic pathophysiology of type 1 diabetes is to have it, to have some susceptibility, genetic susceptibility, so genetic contribution, and then you have a trigger like virus or toxins or diet, certain diet, that triggers the immunological process, which leads to beta cell toxicity through autoimmune process. So you have this autoimmune process by T helper cell mediated that will lead to secretion of cytokines and macrophage activation, which will ultimately lead to beta cell destruction. So the progression of type 1 diabetes, so you have this trigger environmental causes, and then you have beta cell mass with the genetic predisposition. You have the progressive destruction of beta cells when it reaches a critical stage of about less than so 75% of the beta cell mass destroyed, or slightly more, 85%. Then you have little bit remaining of the beta cells, and this will make the patient a patient of frank diabetes. Before that, before the diabetes become overt, some of the remaining beta cells will try to compensate in a honeymoon period, which may progress up to 1 to 2 years. Usually it takes about few weeks to happen, but a few weeks to few months. The longest reported in the literature is up to 2 years. And in this time, you have progressive impairment of insulin release. So this is a period of impaired glucose tolerance. But when you reach this stage of considerable loss of beta cell mass, then frank diabetes appears. And then in that time, you need exogenous insulin supply. But this is just telling you that type 1 diabetes is very prevalent and with a high incidence. This is an old report, okay, in different countries, including Sudan, Saudi Arabia, okay, Finland, and some parts of Australia and North America, and especially in Canada. And it can be underreported in some areas, like in Africa and Middle East, but that's why you have higher numbers in Australia. These are some old reports. They are more recent ones. So this is an interesting graph. So projecting the future of diabetes population size and related costs for treating them in the US. And what's interesting about it is that those who are diagnosed at these years are expected to be lost earlier, but you have increasing cumulative incidence of the disease, not necessarily with the same patients, but with new patients that also expires earlier. So it's not a simple disease, and also increasing in incidence and putting a burden, financial burden in these communities. This is King's College in Cambridge. So management goals is to prevent death in these patients, alleviate symptoms, and to achieve biochemical control, so good glycemic control. And this will be reflected in pediatric patients in growth and development, and to prevent acute complications such as DKA and hypoglycemia, and prevent and delay late onset complications such as in the eye, so micro and macro vascular complications, eye, kidney, and central nervous system. So the management components include insulin and support in terms of education about carbohydrate counting, insulin carb ratios, self-care, testing injections, hypo-management, sick day roles, psychological support, okay? Any patient with chronic illness require this, especially receiving medications by injections, annual reviews in terms of examination, including microfilament examination for the peripheral neuropathies, and investigation, including blood and urine investigations, eye examination, so fundal examination, and lifestyle monitoring in terms of diet, exercise, etc. Okay, sensible exercise. Again, okay, you need obviously in terms of insulin, you can use regular insulin اللي هو الصافي versus MPH هو العكر اللي هو intermediate acting insulin called MPH. So you use it in a ratio of 1/3 and 2/3. So 2/3 for MPH and 1/3 for the regular. Analogs, so different analogs, so mixed type of insulin like Novomix 30 or Humulog 25, ultra short like Novorapid and Humulog, Detimir or called Levimir and Glargine, and these are the long-acting insulins. So the insulin analogs are synthetic insulins, while the regular and MPH also synthetic, but some of them can be animal insulins. The analogs are similar to insulin structure, and with additional detergents can have different durations of action and start of actions. We will see that in subsequent slides in the graphs and in tables to see when the insulin starts to work and what is the peak, when will be the peak, and what is the duration of action. So just be familiar now with the names. You have regular and MPH, الصافي regular, MPH العكر, and then you have, before you say the mixed, let us talk about the ultra short. The ultra short is, we have three main companies. So we have the Novo Nordisk. So all the Novo, okay, named insulins are after the name of this company, Novo, Novomix, Novorapid. Novorapid is a rapid one. Novomix is a mixed one. So you have Novomix 30, it means that 30% of it is Novorapid. And intermediate, like MPH is 70%. Okay, you have mixture between the regular and MPH as well. It's called mixed tart. So this is an Actrabid. Regular is also called Actrabid if it is prepared in a pen. So Actrabid and MPH. This is a mixed tart 30. The Novo Mix 30 is the Novorapid with MPH. Okay, so it's a long acting or intermediate acting. So and then the second company, Novo Nordisk, you have Eli Lilly. And Eli Lilly is a producer of all the Humulog. So you have Humulog 25, Humulog 75, Humulog 50. So you have Humulog 25, Humulog 50. So 50, it means that 50% is rapid, ultra short, and 50% is intermediate or like MPH. and Humalog 25 means 25% of it is rapid, and the 75% is like MPH intermediate. And then we have this long-acting, flat type in function insulins, the glargine, which is a Lantus. Glargine is a Lantus. Detamir is a Levemir. These are the trade names, Lantus and Levemir, and these are the chemical names, Detamir, glargine. Okay, the Novorapid, the chemical name is Aspart. Novorapid, the chemical name is Aspart. Is the Humalog is what is it called? The chemical name of it, Lispro. The Humalog, the chemical name is Lispro. Right? And then we have the company that produces Lantus also have a rapid insulin. It's called Apidra, insulin Apidra. Insulin Apidra. Right? Apidra, the chemical name of it is difficult. It's called glycerine. Glycerine. So the trade names are more famous than the chemical. Aspart هو Novorapid. Lispro هو الهيمولوج. وأبيدرا اللي هو Apidra, this is like Novorapid. Trade name glycerine, the chemical name of it. والcompany اللي هي producing glycerine or Apidra هي نفسها producing Lantus, والنيم بتاعها اسمها ايش؟ اسمها Sanofi Aventis. Sanofi Aventis هي French company. So we have اثنين American هما Lilly وNovo Nordisk, and we have Apidra, Sanofi Aventis اللي هي producing the Lantus. Now, most recently غير Lantus عندنا واحد long acting that works for longer than the Lantus, اللي هما 24 hours, 48 hours up to 72 hours, اسمه تريسيبا. تريسيبا. واسمه الكيميكال ديجلوديك. ديجلوديك. طيب ديجلوديك هو التريسيبا. So تريسيبا equivalent to Lantus. ديجلوديك is equivalent to glargine. الاسم الكيميكال بتاعه. Again, there are 3 long acting. Levemir, Lantus, and Tresiba. اللي هو Detamir, glargine, and what? And Degludec. واضح كده؟ المستخدمين أكثر شيء هم النوفورابيد واللانتوس، طيب، والميكس ستار 30 ولا نوفوميكس 30. أحيانا هيمولوج 25. Then في الانسولين pump, the other name of it CSII, يعني continuous subcutaneous insulin infusion. You can have an open loop or closed loop. Open loop معناها أنت introduce the blood sugar to the pump phase from a test, and you tell the pump how much you're going to eat in terms of carbohydrates. Closed loop, إنه في sensor continuously talking to the pump and tells the pump how much the blood glucose now. So when you tell the blood glucose level, so when you tell the pump how much you're going to eat, immediately the pump will match this with the glucose level, serum glucose level, and will elect you to confirm an insulin dose. Or sometimes it can pass it through itself, so it's completely a closed loop system. Smart pumps can hang up giving insulin now and can give extra insulin from the basal rate if it feels that the blood sugar is going in a quick high rate or going down very sharply. So it has an alarm system and can also be set to levels where it can hang up giving insulin or giving extra doses of insulin. These are called the smart pump and real closed loop system. Okay. Humalog قلناها احنا. تابع يا مروة. I cannot repeat the things, and I speak too slowly. And I speak far more faster than this. لكن I'm speaking slowly عشان to catch up. Humalog من الالترا شورت رابيد تابع لإيلاي ليلي. Yes, Humalog تابع لإيلاي ليلي. ونوفو رابيد مع نوفو نورديسك. وأبيدرا مع سانوفي أفنتس. وهيومولوج لو كتبت على جنبه 25 أو نوفو ميكس 30 that means mixed insulin. يعني 30% few الترا شورت اكتنج اللي هو هيمولوج اونلي، لكن هيمولوج 25 it means 25% is just lispro or هيمولوج و the rest is intermediate type of insulin. واضح كده؟ ممتاز. طيب الكاري اون. طيب قلنا الكارب كاونتنج وانسولين كارب ماتشنج كويس والسيلف كير انجكشنز وهايبو مانجمنت سيك داي رولز دي كلها مهمه. So you have a team of diabetes treating team. So it's not all run by the pediatrician or the diabetologist or the endocrinologist. So you also have the diabetes educator or diabetes dietitian. في امريكا بسموها educator اكثر، في يوروب بسموها diabetes nurse, sorry. Then you have the dietitian, you may have the psychologist or play therapist as well, this part of the team. Otherwise, you have collaboration with them and you see the patients annually by the psychological team. Dietitian, طبعا, they still the major component of diet in diabetics is carbohydrates, 50 to 60%. However, you look at the less طبعا toxic and risky carbohydrates that leads to fluctuation of carbohydrates rapidly in the blood. اللي هم عندك بتقسم الكربوهيدرات ل high glycemic index food, medium glycemic index and low glycemic index. اللو glycemic index ما بزيد البلس شوجر بسرعه، ده الستارش تايب اوف فود زي الشوفان والاشياء بطيئه الامتصاص. او لو اكلت مثلا بيتزا فيها جبنه الموزاريلا اللي هي فاتي مثلا tissue, this will delay the absorption. لكن if you eat يعني dates ولا direct food خبز مباشر this is high glycemic index. أو ممكن تكون جزء منها medium لو كانت شوية من الخبز الأسمر كويس أو النخالة أو كده. أما إذا كان هو أصلا يعني شوجر مجرد شوجر أخذته في أو عسل هني ولا حاجة دي this is high glycemic index will induce hyperglycemia very rapidly. That's why used in management of hypoglycemia. Sensible exercise that will help good cardiovascular function for the patient and also will not lead to hypoglycemia. Will not lead to hypoglycemia. زمان في قصة مشهورة رحمه الله أبو مختار كان بيحكيها دائما لنا كستودنتس، يقول إنه في بيشنت يعني كبير وكان أضل طبعا اندوكرينولوجيست أبو مختار رحمه الله، فبيقول إنه في كان عسكري بتاع شرطة بتاع حركة كويس، فكان في كوبري الحرية دائما بيفطر مع مجموعة بالجزء الآخر الجانب الآخر من الكوبري. بعدين هو أصلا جابوه في المستشفى كان بيرفس كده، بعدين قام الدكتور قال له كده شوفوا جيبه طلع في انسولين قال ادوا اعطوه شجر، اعطوه شجر وصحى. بعدين حكى القصه قال هو اصلا بيفطر مع ناس في الجانب الاخر، بعدين في حادث بتاع حركه اخر ياخذ في البيانات وكده مسجل في البلاغ، بعدين قال الجماعه دول حيفوتوني في الوجبه، وكان اوريدي اخذ الانسولين لانه كان مستعد ماشي عشان ياكل. بعدين قام قال عشان الحقهم اخذ شنو؟ اخذ لي جكه كده اجري الحقهم. فقام جرى هو ماخذ انسولين وجعان في نص الكوبري اغمي عليه، هو جابوه بيفرفر كده وعرفوا الدكتور قال له ده شنو؟ This is hypoglycemic fit. فالاكسرسايز if it is not sensible and not matched well with the insulin dose can lead to bad consequences. So it needs to be sensible exercise, should be matched with the insulin and carbohydrate intake. Okay? طيب طيب الكونسبتس في some concepts are important to be emphasized in the management of diabetes. معلش انتوا انا استاذنكم شويه بس اصلي واجي دقائق بس، لانه حتقام الصلاه بعد اقل من 5 دقائق، فانا هخلي البرزنتيشن حتى مفتوح. الصلاه قريبه جدا مني هنا يعني بس بصلي وبرجع لكم. ذات اوكي؟ حتى محمد بيكون داير يطلع يصلي اظن. دكتور محمد are you with us؟ جزاكم الله خير. اصلي وارجع لكم بسرعه ان شاء الله. السلام عليكم.